So today I'm pleased to introduce an amazing panel. I'm Betsy Collins, not part of the amazing panel. I'm Betsy Collins. I'm one of the OBGYNs at Emory Midtown in the faculty practice at Emory. I'm the baby-friendly team lead for OB at that campus. And I'm also a breastfeeding conference planning committee member and have been working as an attending at Emory since 2011. And I trained at Grady and work very closely with Valtra as well on breastfeeding education for our residents and other healthcare providers. Just a quick note that we use the term breastfeeding here, but this is also to be including chest feeding people and to acknowledge that not all people who have babies and who feed their babies using their own milk identify as women, and not all people think of it as breastfeeding. Just to bring that to the floor as well. The goal of this panel is really to learn about some of the new things that are coming down the pipe involving the PUMP Act, which was recently passed and signed into law, and how that's going to affect our patients and ourselves in the workplace. We're going to consider how things like family leave, WIC policy, formula access, and other policies affect safe infant feeding. And we're also going to discuss some of the ethical implications of formula provision in the hospital in the context of formula shortage. I'm sorry for the very small writing, but these are very awesome people that have a lot of cool things about them. So I'm just going to read this off so you get a better sense of our panelists. So joining us today, we have Yvette Partridge, who's an investigator at the U.S. Department of Labor. Yvette joined the U.S. Department of Labor Wage and Hour Division on September 8, 1998 as an office assistant and worked her way up to investigator in October 2010. Yvette has conducted compliance investigations under many federal regulations such as the Fair Labor Standard Act, the Davis-Bacon Act, the Service Contract Act, the Migrant and Seasonal Workers Protection Act, and the Family Medical Leave Act. While employed with the Wage and Hour Division, Yvette obtained her associate's degree in office administration from National State Community College, her bachelor's degree in management and human relations from Trevecca Nazarene University, and her master's degree in public administration from Troy. So thank you for joining us, Yvette. We had several people at the Department of Labor that we were communicating with, and she stepped in sort of at the last minute, so we're really appreciative of her joining us today. Next, we have Nandy Marshall, who's a doctor in public health. She's the Associate Professor of Community Health and Associate Dean for Academic Affairs at the Suit College of Public Health at Georgia Southern University. Dr. Marshall has over 19 years of community engagement experience, including fostering partnerships and relationships with grassroots organizations, state coalitions, nonprofits, and national associations, particularly around health inequities. Dr. Marshall has served as a member and leader of numerous public health organizations, including as a board member for the American Public Health Association, as an APHA member representative for the United States Breastfeeding Committee, as a member of the USBC Crash Committee, which focused on equity issues in breastfeeding, and as a member of the board of the Georgia Breastfeeding Coalition. Additionally, she recently served as the education and training co-lead for the Georgia Society for Public Health Education. Dr. Marshall is currently leading the breastfeeding continuity of care work for the Savannah Hope Project, which is funded by CDC REACH and led by Healthy Savannah and the YMCA of Coastal Georgia. Whew. Kai Lindberg, Master of Education, Chief Executive Officer of Healthy Mothers, Healthy Babies Coalition of Georgia, is also with us today. Ms. Lindberg has over 17 years of experience leading local, statewide, and national efforts designed to solve complex social problems through innovation and creative design thinking, centering equity in her overall approach. In her current role, she works with multi-sector stakeholder groups to improve maternal and child health from conception through 12 months postpartum. Her work focuses on improving policies, bolstering the workforce, and expanding access to education, clinical and community-based resources to ensure moms, birthers, and babies survive and thrive. And last but absolutely not least, we have Valtra Harris, who is the lactation program coordinator at Grady Memorial Hospital. Valtra has over 20 plus years of working with mothers and babies. Valtra's career began as a health educator, teaching parenting and prenatal classes in 1997. This led to teaching breastfeeding classes for Swope Health Center in Kansas City, Missouri, and ultimately a career in lactation. Valtra became the first African-American IBCLC in the state of Missouri. Wow. Valtra has been a pioneer in helping and empowering women to breastfeed Valtra is the mother of 5 and enjoys hiking, cooking, and gardening. Can I get a round of applause for our panelists? We don't have any disclosures. So, the Pump Act, which I think is probably the elephant in the room. So I think probably what many of us want to know is, what is this going to do to our workplace? And so I'd really love for Yvette to get started with us, because she represents the Department of Labor and has worked so prominently on all of these other sort of workplace affecting laws and policies, sort of what she would envision that this law is going to bring to us and change about expressing milk in the workplace.
Okay, so a quick overview. Can everyone hear me? Okay, a quick overview is, if your company has 50 or more employees, and that's company-wide, not per store or per location where it's needed, it's a company-wide, 50 or more, you must supply a area for an employee to pump breast milk. It has to be lockable, private, and it can't be a bathroom. So that's basically it, and you get the accommodation for a year. They had talked about 2 years in the act, but they changed it to 1, so still 1 year like it was before. But the biggest change for this act is that it's extended it to the employees who are on a salary basis, because before it was basically just for employees who were paid by the hour. So now your salaried employees get this protection also. And if they're using their break time, their regular break time to do it, they have to be paid. So you can't deduct the time. And one other thing I was thinking about, I'll remember it later and tell you. But yeah, that's the biggest thing, is that it extended it to the salaried employees.
So Kai is my go-to for how this translates into implementation.
All right, so I'm gonna try my best to hold this button down and talk at the same time. I can't dance and I'm not very coordinated, so y'all bear with me. Well, this is one of those times where I'm actually excited to poke our chests out here in Georgia. One of the things that the Pump Act has is a preemption, meaning that if a state has a better or more rigorous policy, that policy will be upheld. And if a state does not have a rigorous policy, then the federal law will take precedent. Well, back in 2020, we passed Charlotte's Law, which ultimately did a myriad of things for lactating persons, including having that sacred space for individuals who have young children 2 years or younger. So almost all of the provisions that are highlighted in the Pump Act were already kind of in our policy that passed several years ago. Now, one thing I will highlight, and I know we'll dive deeper into this conversation a bit later, is there's one thing to have things in the books, and then there's another thing to have it highlighted in implementation and practice. So one of the biggest barriers that I'm sure many of you face is number one, I didn't even know this thing passed 3 years ago, right? Families, I didn't even know that this was a thing, particularly those who are low wage earners or who are in high stress environments, right? So I think, yes, it's really exciting to have these kind of laws pass, but then how does that translate into individuals' lived experiences in their everyday lives? And I'm excited to explore that further.
So what do you think is going to be the best way to spread information about this law, especially to the most marginalized workers in our society? And this is an open question for the panel.
So my background is health education. And so I think for me, the first response is to make sure Apparently, I'm having a hard time with the button too. Sorry, I'm a hand talker, so my hands were trying to move. So I think for me, that health education piece is extremely important. One of the things that we continuously talked about every time we met is it's great to have a policy on the books, but if people don't know about it, then we're really missing the mark. And so I think it's going to be important to go beyond just our traditional areas, but we need to be going to PTOs. We need to go to schools. We need to go to faith-based organizations. Wherever the people are, we have to go there. We can't expect people to come to us to get the information. Pieces like this, we have to really make sure that communities know what's happening. And so it's definitely going to take a coordinated effort, working across sectors, not just public health, not just medical, not just, community organizations, but across every sector to really make sure that we're getting this information out.
Yeah, I'd like to add to that. And it's not just getting the information, but sharing the information in a digestible way, and not in a punitive or accusatory way, right? So I think oftentimes when we think about kind of the work that we do, we want to give everybody the gold standard, right? But then life happens. And often we always like to think of marginalized groups or individuals in high stress situations. But I have 3 broke best friends who have passed through my body. And even with all of the knowledge that I've gained and experiences that I've had, in real time, like, things are hard. Parenting isn't easy. And having a human either attached to your body getting sustenance is not always exciting, and having an apparatus affixed to your chest is equally as challenging on those days when you've worked 10 hours and have slept 1, right? So I think that often we need to humanize the information that we offer to families and also be nimble and have a conversation and not a dictation to the individuals that we serve. And there's no replacement for human interaction. And I know folks may disagree, particularly my 20-year-old who, lives and identifies with everything social media. My LinkedIn game is strong, but that's probably about it. But us in this type of service industry sometimes rely on pamphlets or posters around, and especially when we discharge families, right? We want to give them literally everything that we can think of that they need. And it's like, I come home with this packet of information and a baby. Which do you think I'm going to pay attention to, right? So I think we need to disrupt ourselves in our busy lives and slow down and have conversations. But more than that, we also need to educate ourselves, because a lot of times we get information from a friend of a friend of a friend. And the nuances of legislation are that. So, for example, that 50 employee threshold, if you have less than 50 employees, what does that mean, right? And if there's a hardship experienced by the employer, what does that mean? Do we just say, they don't have to offer it, or do we get creative? And I remember someone shared a really powerful story during our prep, and it was about like a McDonald's, right? And they had a lockable space, but there was a camera in there, right? So it wasn't private. They could have said, okay, for security purposes, due to our regulations, we have to have cameras in that sacred space. We don't have to adhere. But instead of that, those little partitions, they just put up a partition and blocked the camera so that when a lactating person went into the room, they had sacred space. So that is just an example of many that we need to kind of equip ourselves with, just like when we want to encourage families to breastfeed. Think about how we can encourage employers to also be nimble in providing these sacred spaces for people to either, pump or express milk.
Along those same lines, what's the appeal process like? Let's say you're an employee and you feel like your employer is not complying with the law. How do you file a complaint with the Department of Labor?
Our agency takes complaints from all over the country every day, practically every minute of the day. And Georgia is one of the highest volumes of callers of the state anywhere. But if you feel that you have the right to pump milk and the employer is just telling you, I don't care, you can't do it, you can call our agency. It's 866-4-US-WAGE, and I don't remember what the numbers are, but 866-4-US-WAGE, and that is a answering service. It used to be an answering service. I think it's live. It's still live answered, but we answer our own calls now. And you can talk to someone, go through what's happening, and we can advise you whether or not you can file a complaint. And if you do file a complaint, we'll go out and investigate. And a little later it says about protection. If you file a complaint under the Nursing Mothers Act, or if you file a complaint under this act, you're protected under the FLSA retaliation prohibitions. So because the Nursing Mothers Act is registered under the FLSA, you still get that protection. So if you feel that you need to call us and ask questions, we're there from 8 to 4:30 every day, Monday to Friday.
So I'd like to say something, speak to that. So talking about retaliation, right? So I had a mom, she was like in like a auto dealership, kind of midline, not really nothing fancy, where they're gonna have to adhere to laws, but not like mom and pop either, you know. So the thing was, she said that they never were giving her time to pump. Like it always was some pressure, nope, you don't have time. And so, you know, I'm giving her the good back. Look, they can't tell you not to pump. This law says this, blah, blah, blah. So she goes back and tries to have a little conversation with them. And what they did was, and you know, of course, you know, this is what you're saying, like we need to be knowledgeable, not just from he said, she said, more in depth. But she said what they did was they just put pressure other areas. So they let her pump, like, oh, okay, you got to pump at 10. Cool, you do that. You go pump at 10. But she said they made it so hard, like with other stuff, like it was just pettiness that just became to the point she ended up just leaving and going somewhere else, which she, I mean, maybe needs to do anyway if they were treating her that way. But that is a lot of times like the stuff that I see that sometimes with places that know the person's not can afford an attorney, they're not going to really call anybody. It'll be 4 weeks, 5 weeks before you get out there, you know, that type of thing. I think is how do we handle that? Those things when that happens.
So I'll jump in quick. I see Kai wants to say something too. And so what I'm about to say is not the answer. It is one of many answers. So I want to make that clear. But I think it's really important that we also have business buy-in and let them also see why this is important for their business. Right. So, of course, you know, we can obviously come through your employee needs support. Right. That's one. But really talking about that business case. Why is this important? Why should we allow our lactating employees to have this time? What is the benefit for them? What is the benefit for their babies? Their babies are not going to be missing as much school. Right. So your employer will be here working, like really talking about what's in it for them. The same way that when we're trying to get policies passed, we have to bring that human aspect and we have to tell stories about why this is important. People want to hear more than data. They need to have a personal connection if they're going to make a change. And so we have to really make that connection and make them care about how this is going to affect their dollars and cents. And I promise you'll get more buy-in.
I think that number one, you know, Georgia loves to tout how we're the number one place, especially in Atlanta, to work, right? And people got to work them jobs. And some of those people, excuse my French, have the ability to, you know, feed babies from their bodies. So, I mean, duh, right? But on a more practical standpoint, I think that's where I get joy because I'm an advocate, right? And it becomes such a burden, especially when you think of families who have to assess the hierarchy of needs, right? It's like, number one, I need a job. I may be a low or moderate wage earner. Is it easier for me to just say, you know what, I'm not even gonna pump. I'm just gonna get his baby formula so that we can live? And that is 100% fair, right, for them in their circumstance. But it's not fair for me as an advocate for a person to be in that space where they have to make such a dreadful decision. And I slide in, from my dark corner and say, okay, you don't have to fight, but I'll fight for you. I'll fight with you, alongside you, however you need me to show up so that I can connect them to my colleague here and other organizations who are narrowly focused on upholding the law and their rights. But that is a long game, right? And we need to be very open and honest about that with ourselves and with the person we're supporting. It's not going to be instantaneous. We wish that we can change biases. I even remember in my own family with my first son. I was just shy of 21 years old, Medicaid recipient, working a bunch of jobs. My husband was deployed, and I whipped out the boob to feed the baby, and everybody in the house was like, "You're so nasty. Why are you doing that?" I'm like, "Nasty? Isn't that what a boob is for?" Right? And everybody in my family certainly was not supportive of it. So just as stigmatized as it was in my own household, when you talk about the corporate environment in the private sector, there still is a lot of biases and just lack of education there. So we as advocates and professionals can't wait until laws like this pass. It is a continuous education for everyone to destigmatize breasts, right? Destigmatize feeding your babies, and also know that, females or birthing persons, like, we are a significant part of the workforce, significant. And, everybody likes to use this line, and I am no exception. COVID really was one of our best teachers, right? It showed us just how powerful our presence is, and we demand more, and folks are listening in this moment in ways like never before. So I encourage you to use your voice and your resources to be that advocate for others who just are too exhausted to advocate for themselves.
I think the other thing too that's really important is really along those same lines with what Kai was saying, is like, recognize your power, right? So like sometimes even just sending a letter with a patient to their employer that says, hey, my patient so-and-so is going to need breaks for expressing milk at work this many times a day for this many minutes. They could totally ignore it, but they might be like, oh, there's a doctor's letter. Oh, the nurse, gave them a letter. You can even start to throw some stuff in there in accordance with the Pump Act, But I'm just saying, this is what people do, right? And, the person who doesn't look so deep might be like, oh, I need to do this in accordance with the Pump Act, And we'll talk about hardships, but the point is, like, you have more power than you think. Okay, so like one of the things that I have discovered is just a little anecdote about how much power you have that you didn't know you have, is that I actually get to decide how much medical leave somebody gets when they have a baby, right? But I didn't know that that was my power, right? So I had been doing whatever my office had told me, 6 weeks for a vaginal delivery and 8 weeks for a C-section, or, so on and so forth. Guess what? I get to decide that. Not my office, not my boss, not someone else's boss. There's like actual medical science and evidence about how long people should be home after they birth a child. And I get to write for at least 12 weeks. In fact, I never write for less than 12 weeks ever, because in my medical opinion, it is not appropriate. You are not medically able to return, okay? That is my decision as your doctor. So there are things that are within our locus of control that we did not realize were in our control, okay? So I want everyone to think about the things that you can influence and influence them. When your patient says to you, or your friend says to you, so frustrated, this thing isn't happening at my work, and you're like, well, let's write a letter about it. Let's see what happens. Like, maybe your boss doesn't know about the Pump Act. Let me give you some information that you can take them. Let's give you a letter that says you should be pumping at work. Try it, right? What's the worst thing that can happen? They say no. And that's where the Department of Labor comes in. So I just want everybody to think about that. And my next question is, does this law apply to Seasonal workers who are here on visas, do you have to be an American citizen to have this apply to you? What's the answer, Yvette, behind door number 2?
Unfortunately, I'm not sure.
Okay, that's fair. And then can we discuss about what a hardship looks like? So when can a business ask for this law to not apply to them?
Just as a thought, seasonal workers, your employer has to have 50 or more employees. So most of the time, most seasonal workers, they're not employing 50 people. So that would be a no.
Okay.
But if it was a large organization like a huge farm that had hundreds of migrant workers come into work, then that's a possibility.
Can I just add to that, right? Like anecdotes, and to my earlier kind of comment around, even if you're kind of not required by law to offer this, we can still be creative and encourage it, right? So again, me and my stories, I shared a story about, this was in California, not Georgia, I'm gonna own that, how a migrant worker was lactating and they were out in the field, right? So like, where are you gonna have a lockable safe space in the middle of a field? Nowhere, because we traditionally think of brick and mortar buildings. But guess what? There are trucks and vehicles that lock, that you can put screens in the windows to provide that space for that birthing person and that lactating person to express their milk. And no refrigerator, but they have these handy dandy things that we take on picnics all the time called coolers and ice, right? So it's moving beyond like what our image of what this environment needs to look like. I even think of breastfeeding posters. You have this pretty little white girl in like a corporate office with a big smile on her face and her electric pump on her arm, right? With her thumb up talking about, let's breastfeed. And I'm like, what about me? My hair ain't done. I probably showered a week ago. And I've been on my feet, 10 hours. Can we depict that in the poster, right? So that people can feel more connected and get away from this idealized vision of what these situations look like. And for a very lucky few, it may. But for the vast majority of us, it does not. And sometimes you just escape to the bathroom so you can have 5 minutes of alone time, right? And we need to like normalize the realities of what being a lactating person looks like, even in the professional space. What about if you're a construction worker? What about even a CEO of a nonprofit, right? Everybody has, spaces and needs for you, except you have no needs for yourself, apparently. If you're in a hospital, you would think, oh, there's tons of places for me to express my milk. Actually, no, there isn't.
No, there's not.
Right? So we really need to think about those pieces. In addition to the hardship conversation, right, and those omissions, it's like, even if you are, I hear all that, but let me tell you how you can still encourage and support your lactating persons.
So let's talk a little bit about hardships. So if Yvette and Kai and anyone else who understands how a business could apply for a hardship and when that would be allowed.
Wage and Hour Division would look at it when we conducted the investigation and discuss with the employer why they're not providing the space. So if they tell us that there's no place in their area, there's no place in their building or area where they're working that they can provide, and to build a separate space would be cost preventative and time consuming and just not feasible for it, then we would have to take those recommendations, or take those things that the employer said, and I would have to go back to my supervisor and discuss it with them, and possibly even talk to our solicitor's office to see if they qualify for an exemption. I've never had to do it, but the investigations I've conducted, the employers were providing, the people just didn't like the places they were providing, but they've met the qualifications, so we couldn't do anything about it.
And that's the petty I'm talking about right there. Yeah.
We're going to take some questions from the audience about the Pump Act.
Thank you so much for having this conversation. I wanted to ask you, from the perspective of enforcement and compliance, I am an employer of about 20 people, so we don't technically have to do this, but we do. But what I'm asking about is I am told that I have to inform my employees of the rights that they have under FMLA and all this stuff. And so we have posters up in all of our locations where employees can easily see it. Could something like the Pump Act be added to those posters, or could employers be required to inform their employees of their rights?
My thought would be that it should be put in with the FLSA information since it's covered under the FLSA. So hopefully, now that the Pump Act is enacted, they might add it to the FLSA information on those posters. But I'm not a policy person. I don't make the policies, so I can't tell you that that's going to happen. But logically, you would think that that would be the easiest thing to do.
Fair Labor Standards Act, just over FLSA.
I also wanted to add first, thank you. You're exactly the example that I was talking about. But also to the posters are great, but having conversations is even better. When I see those posters in our break room, they are just like a tree. Beautiful, but I don't necessarily pay close attention to them until they're gone, right? And I think with those posters, especially depending on the type of employee, they're kind of just there. No one really reads them. And I would encourage employers to maybe do professional learning around them, have human resources dive into the conversation. But moreover, like those individual conversations when someone is pregnant and postpartum will be very helpful to add to that.
Could you tell me, what does protection from retaliation look like? Like, give us some examples of how someone may be protected.
Wage and hour would come in after the fact and determine whether or not the employee was retaliated against. And if they were fired, we would seek back wages from the date they were fired to the date they found another job, or have them reinstated with back wages from the date they were fired to the date they were reinstated, because they shouldn't have been terminated. So they should have been getting their normal payroll. But we would go in and look at the circumstances, and it's always on a case-by-case basis.
I'm sorry. I just wanted to make a comment. A lot of times when we're talking about educating about anything having to do with breastfeeding, chest feeding, feeding human milk, we always like to mention that it should start before the baby's born. And I think this is another one of those issues that we should be talking to moms when they're pregnant and asking them, have you talked to your employer? Will you have this space? That sort of thing, because I think that, it's something we should know in advance. And when young women have choices about where they're going to work, maybe they should be asking these questions ahead of time, not just for them, but for all women and all babies.
I have a comment for that. Employers who are covered by the family medical leave, 50 or more employees within a 75-mile radius of where the person works, maybe they should include fact sheet number 73, which covers the Pump Act and the break time for nursing mothers law under the FLSA. And maybe this should be included with the doctor certification and their employees' rights and responsibilities so that they know that they can have that when they come back.
That's a great idea.
So, yes, and I want to take that a bit further. I think we as a larger community need to do a better job about also informing people who will never have children or who will never nurse, because it's good to have those advocates in your corner. So even though, let's say, for example, so my husband works at the post office, right? And so even though he will never be a lactating parent, he works with people who will. And so he can also say, hey, no, that's not right. I'm standing with her, or I'm standing with this person because they deserve their break. And so with so many things, including breastfeeding, I feel like more people need to be educated, even if that won't be their circumstance, because then we have more people standing together and fighting for what's right.
Mm-hmm. Yes, snaps to that, right? So this is in my mind aligned, but it's not, and it's around destigmatization and also practicality. Yeah, and I think we all are aware that our society is still learning when it comes to women and birthing bodies. And I have 3 sons, as I shared before. Y'all don't laugh at me, but when I have my menstrual cycle, growing up, my dad, when I got my first period, told me to just hover over the toilet until it stops. And I was like, Dad, that is terrible and impractical. Moments later, my mom brings me pads and my baby brother put it on his forehead and ran down the street because he liked the cool headbands. And although in the moment it was incredibly embarrassing and there were so many opportunities to educate my brothers, now that I have sons, when I have my menstrual, I no longer say it's just mommy's special time. I explain to them what a menstrual cycle is in an age-appropriate way and let them understand that it's a normal, natural process. When I breastfed my younger 2 sons, I failed to mention that my boys are 6, 8, and 20. I wouldn't hide. I wouldn't wear wraps. And it took a while for my eldest son to get comfortable with it. But I said, this is a beautiful process. This is what being a birthing body looks like. And I think if we continue to be very steadfast in destigmatizing these very natural, beautiful processes, but also understanding that that may not look the same for every family. We want everybody to ride around in Lexuses and Teslas, but unfortunately, our income doesn't allow. So you might have had to get an 87 Chevrolet Cavalier with your $600 when you first graduated school, right? So I think that we need to understand that, yes, the gold standard is this beautiful lady with her hair flowing in the wind, breastfeeding, but also it's the constipated mom with hemorrhoids who hasn't slept for 5 minutes, and is also needing to express milk. And if she doesn't even supply enough, her homie next door is, lactating like crazy, and it's not nasty for her neighbor to donate milk to her so that she can sustain her child. So I just think we need to do a broader, better job of dispelling stigma, building awareness, and employment opportunities just need to align and step up. My last thing is, I am so overwhelmingly proud of this generation of workers now. I mean, when I got my first jobs, I was thankful to negotiate salaries, to talk about mental health, to talk about a place to express. I would have never, right? Now they come in like, let me tell you what you're gonna do. And I'm like, all right, shorty, I'm just still nonprofit. I can't pay you 6 figures, but I can give you a couple hours of mental health, right? So I definitely want to make sure that we honor the fact that a lot of work is being done, and we often think of all the negatives, but we're getting there begrudgingly. So let's honor that.
I just wanted to share. I work with Betsy at Emory Midtown, Dr. Collins. And one thing that I would just encourage some of the lactation consultants to do, Emory Midtown has offered 2 different prenatal breastfeeding education classes. And I definitely liked it better when it was in person than Zoom, but I see the benefits of both. But our breastfeeding one is breastfeeding basics. But I think it's fairly unique to the metro Atlanta area. We offer a breastfeeding 2, which is pumping and returning to work. And so I do have the opportunity to share this with parents, and we encourage the entire family, whoever's in the house, to come to the class. And I will occasionally, back in the day, I got a comment from a young girl that showed up to class. This was before the airports had the pumping pods. And so this young girl said, I work at one of the restaurants in the airport, and I just don't think it's going to be a possibility to even pump while I'm at work at the airport. And so, if we would have had the pumping pods, that may have been an example we could have shared. But it is an opportunity to dialogue if you have that breastfeeding 2 or that pumping and returning to work class. I've even contacted Enjoy, that is the company that has sort of a PowerPoint for breastfeeding 1, asked them if they would be willing to make a breastfeeding 2. Patiently waited for almost a year. They said they were putting out a breastfeeding 2, and I explained to them exactly what I wanted. Well, when this class ended up coming out, it was just a revision of what I would have considered pumping 1 or breastfeeding 1. And so there's really not a good quality pumping and returning to work video that I have been able to access. So if you guys have them, or if there's even, when we became baby friendly, we were able to do just a beautiful photo shoot at Emory Midtown, and anyone that was part of the Emory network, we were able to share those. So Grady was able to see some of those pictures, but our own patients were in that photo shoot, and that's what we made the education material. So if there's, again, this is a collaborative environment where we may be able to put our heads together and think of some things, patients, but being able to share these things with them. And, even in doing my research of being able to teach, I looked up online and found that KFC had a lawsuit against them for not providing a time and a space for that mom. And by the time the lawsuit went through, she had completely lost her milk. But I think being able to share some of those things and hearing the specific examples of how, examples we can give the patients of, this is maybe not ideal, but this is what, you could maybe suggest to your boss. And letting them, even another example was where a lady traveled internationally again before COVID. She was scared to death that she wasn't going to be able to do her job and pump. And I just encouraged her. I said, if there's a will, there's a way. Between breastfeeding 1 and 2 classes, she ended up going to her employer, and the bosses had already decided before she even went out on maternity leave that she would not go anywhere for travel outside of the state of Georgia until the baby was 5 months old. And so she was pleasantly surprised, but encouraging them to have that conversation before they ever go out may help them to get what they need more so. And just being able to include that in your prenatal breastfeeding classes. I don't spend much time on it. I don't bring up that KFC example because I don't really want to go negative. I want to keep it positive as much as I can. But having those examples to sort of empower those young moms that, maybe we can find a way to help you do this.
Yeah, and maybe include some of the Pump Act provisions so that people know what their rates are too, which I think is really important. We'll take one more question on this slide.
I really quickly want to just say that's where advocates like ourselves who work with the coalition can really step up, even though I have a lot of thoughts around why community is often tasked with coming up with solutions for policies that are put in place. But shameless plug, y'all, our pickles and ice cream platform, we do a lot of videos, and you just gave me an idea. Hopefully you're okay with me borrowing it, of some content that we can put together and disseminate for folks to use.
And make sure at the end that we tell people how to find your pickles and ice cream info, because this already sounds fascinating. All right, we're going to take one more.
The last one I had is, don't forget what's on womenshealth.gov. You've got to dig down. You really have to dig down to get to their information, but it's very good on womenshealth.gov. And Colorado Breastfeeding Coalition has the best, funniest, well-done video. They did it probably in 2010, but it's good, where they interview a guy that's really a comedian and he's an employer. If anybody's ever seen it, it's on YouTube. Just look up Colorado Breastfeeding Coalition, where they interview him about somebody returning to work. And then the only thing I wanted to add was, in the Pump Act too, you still have our rail, bus, and
Transit.
pilot, what am I calling, airline industry that are still excluded. That is still a loophole there. So you've got all the transportation systems are still excluded. But the other good thing to the law, which I didn't hear anybody mention, I thought I would definitely share it with everybody, is that even if you start relactating after a period of time, or you've increased your milk supply where you didn't ask for pumping provisions right when you came back to work, now the parent is protected to start that later on. You may not start asking for pumping provisions until your baby's 8 months. So that's something new part of the law. I didn't hear anybody mention that unless
That's
that
great to know.
changed. So I thought I'd share those two things.
I have one question too that we didn't address. You brought up a really good point. So I've had people who were told by their employers that they should wear wearable pumps, and I've had people told that they should not wear wearable pumps. Does anything in the Pump Act address wearable pumps?
Not that I've read.
Okay. But it does say that you have to have a private space. So my guess is that, like let's say you're, driving the train and you are on shift for 8 hours. Agreed. It's going to be difficult for them to provide a private space. They probably can't tell you not to wear a wearable pump. So that's something, but it's probably not specifically addressed. Yeah, absolutely. So there's issues, applying a wearable pump, emptying a wearable pump. It's not an end all be all. And, we see surgeons use them. We see lots of people who have long tasks, and they also don't work for everybody. So I think it's really important for people to understand that while wearable pumps are an option for some people, they don't work for everyone. And employers still need to comply with the Pump Act if they don't have a hardship. I think, okay, one more. All right. You got me.
It's along the same lines, but when we're talking about a reasonable break time, and we're letting the employer interpret what is.
Are we?
I don't know. What is?
I don't know.
What are we? That's what I'm asking.
Are you the expert or are they the expert?
I don't know. Who is? The employer should be allowing the employee to determine what the reasonable break time should be, correct? How is that?
As a lactation consultant, we understand kind of the reasonable time that it would take to pump and to do everything. But let's say that employee is taking 45 minutes to an hour 3 times a day, and also is taking their breaks and all of those things. Now, as a breastfeeding advocate, I certainly want them to pump, but where does that line get drawn, and how do we do that in a supportive way?
The fact sheet says that
It's what's written down.
I lost it. The frequency and duration of break needed to express milk will likely vary depending on factors related to the nursing employee and the child. So I think that you need to talk to the employee needs to talk to the employer and say, normally it takes me 15 minutes to pump. So I'll need an extra 5 minutes to set up, clean up, and so I'll need 20. So because the Act does not give a specific time, there's no specific time required.
So I just want to add, normally I like very stringent regulations, but this is probably one of those situations where I actually agree with the way it's written because of the variability in the amount of time that it takes for different lactating persons to express milk, but I liken it to anything else. Let's say that the employer notices that, their employee is 45 minutes, 3 times a day, in there, so, that's when you can, address the situation. And if indeed medically that's required, then your employee will have to have sufficient evidence to support that. Inversely, if your employer is like, You got 5 minutes. Do what you got to do. That's where my colleague here comes into play, and you're like, come on, man, I'm just getting it together. Like, you got to give me a little bit more time than that. And I think finding that good balance and having that mutual respect and trust in the workplace, one, fosters a healthy working environment, right? But two, creates a precedent that others around the country can look at as a model of what that baseline time period looks like. And I think that general acceptability is 15 to 20 minutes, right? But for some, it might take more or less time.
So in my organization, I did a survey, and I asked anybody who wanted to take the survey, who had lactated within the last, I think, 3 years, how long they needed to pump while they were at work during the average shift or work day. And the average answer, or the most popular answer, was 30 minutes. And most people pumped 3 times a day while they were at their shift. So that's an hour and a half. And at the time, my facility had 1 room in the entire hospital. And this takes up over a block of space. So any person in the hospital who needed to pump often traveled 10 or 15 minutes to the pump room, pumped, cleaned up their supplies, stored the milk, and went back to work. So it made really good business sense for the business to put offices closer to the people who needed them, because transit time was a problem. So if there are things about how people are pumping that you can make easier, like closer locations, fridges, sinks, things that reduce the amount of time that the person needs for the entire setup, strategize, right? Because trust me, my employer did not love that people were spending an hour and a half of their day, 45 minutes of that was just traveling to the room, right? So it was an easy business case, but, let's move on, I think, to the next.
Hey, Dr. Collins, I wanted to mention one thing, and it was just in talking with patients at the class. There was a physician that came in very skeptical that she would be able to pump at all with her duties throughout the day. And again, just brainstorming with the patients and helping them kind of figure out something. I shared with her, she was basically on shift from 7 a.m. to 7 p.m. and until about 12 noon to 1 o'clock. From 7 a.m. to 12 noon, didn't think she would have any opportunity whatsoever. And so we kind of talked about the idea of, do you have a 5 to 7 minute break? And so she felt as though she could pump for a very short period of time. She might not be completely empty, but if she could pump at 9:30 or 10, and then again at 11, and then have a full lunch break at 12 noon, there were workarounds that would still allow her to potentially pump. Dr. Carpin had a resident with her that she wasn't sure if she was pumping or not, and she was on rounds with the hands-free.
So this is just a little story about a positive story. So I met the brand new pediatric surgery fellow. We say they have work restriction hours, not really the surgeons. And she was new, and she's very petite and small. And I thought there's no possible way that woman has that shape. But I didn't want to be bold and say, hi, are you pumping? So I found out from her colleague, I said, she's great. She's wonderful. She's really smart. And he said, yeah, she's amazing. She's a 3-month-old. She's pumping exclusive human milk for this baby. I said, ding, ding, ding. So she had support of the entire surgery department at Children's, and she was wearing the wearables, and when she couldn't get, and literally scrubbing out of the OR to empty, scrubbing back into 15-hour cases. But they supported her in doing this, and they're like, look, you do what you need to do. And she's like, I just need to go empty, and I need a place. And I said, here's all our stuff in the NICU. Here's our fridge. Here's our freezer. Leave your stuff. We'll make you a bin. And so it takes creativity, but you're right. The conversations, this is the first fellow the surgeons have ever had that has done this. But now they're like, that was great. This is awesome. We can totally do this. And it makes the program much more attractive to future people coming to interview. And reminding employers, it makes them attractive to women. Right? Smart, good women who want to come work for them.
Over 50% of medical school graduates are women.
70% of pediatrics and neonatology is women. It makes you a lot more attractive as a business and as a company if you support women.
Okay, so let's talk about paid medical leave, something that doctors and hospitals and nurses, and something that we could be doing better at. So can anyone comment on the status of national laws or recommendations that protect or establish paid leave for new parents?
Well, I feel like I'm talking too much sometimes, so that's why I just look awkwardly. I don't know a great deal about the federal legislation, and this is one of those moments where I'll lift up my colleague, Madison Scott, who really is all the nuances with policy and implications, but most recently alongside the passing of the PUMP Act, that paid leave legislation was enacted from the federal government. What that means in real time, I don't know in this moment, but happy to send some information, as a follow-up. I will, though, talk specifically about SB 61, known as the Family Care Act, and that's state-specific. And it recently crossed over from the Senate to the House on crossover day. So if y'all know anything about our legislature, y'all know that we like to play with each other, and we have these cool, quirky terms like sine die or crossover day. Crossover day meaning it's just passing from one chamber to the next before a vote is enacted, right? And it's sent to the governor's desk. But largely what that piece of legislation does is allow people to earn paid sick leave to care for their loved ones, including those who give birth. But that provision is expiring July 1st, 2023. So you'll hear the term sunsetting, and the SB 61 is trying to completely eliminate that sunset and allow it to be enacted for perpetuity in our state, so that, employers are held accountable. And I will say 2 sessions ago, we made a little progress around paid leave in the state of Georgia, where state employees were granted paid sick leave by their employers. Now, the challenge is, like we use something like school districts, right? When policies like this are enacted, they sound cool, but they're not given the money to make them happen. So now we're advocating for appropriations to kind of support those policies. I will say in good faith that I think employers inherently, for the most part, aren't like, I don't want people to be with their families. Ha 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 ha. I'm this master overlord. It largely is like, especially if you're in a for-profit sector, like, where am I going to get this additional expense from? And how am I going to make it happen? And unfortunately, legislators don't think through all of those things and put the onus on us to figure it out. So that's one piece. When we talk about a bright spot, 925 Georgia is an incredible resource. They're leading the Georgia Paid Leave Coalition. Mm-hmm. I like to say that we're like their hype man on this issue. So it's not a narrowly focused issue that Healthy Mothers, Healthy Babies leads, but we certainly get behind it. So I would encourage you to reach out to them because we know that if you're worried about paying your bills, you're a little less worried about breastfeeding. You're a little less worried about other things that we know are really, really just important, not only for the baby, right? I often say, like, after that sweet baby comes, we as birthers become invisible, and people don't look and comment about your glow anymore. They're just like, oh, hi. And you're like, hi, this is when I need the love. The baking and the rubbing the belly is nice, but like, now, can I get a nap? So I think we really need to think about like the mental and behavioral health implications that, that connectivity between that birther and that baby has when they're either, breastfeeding or even when they're pumping, right? So it's all of these benefits that people don't necessarily think about. They only think about the nutrition for the baby most of the time. And I know I'm preaching to the choir in this room, but outside of this room, when we talk about educating and destigmatizing, these are things that we need to lift up so that I don't have fantasies about getting in a slightly not as bad car accident, but one just enough so that people can cook for me and I'm not at home. You know what I mean? So I just think that we need to be very real about these situations. And also, if people can't pay their bills, they can't focus on those babies.
So federal paid family leave failed last year because it wasn't included in the budget because Senator Manchin refused to support it, so it was removed from the final budget. There's still no federal act protecting people who are out on sick leave and providing paid care. So let's talk about California, which has 12 weeks of paid leave. And if anybody has any information, I think that they're an excellent example. If anybody knows about how they do it or how we could be talking about it here in Georgia or at the federal level, I would love to know more. What do you got, Kai?
I was just Googling something. I'm gonna be honest with y'all. Like, Madison was in DC 3-4 months ago for paid leave, and I was 100% sure she said that something passed, but I don't know exactly what it was. So I was Googling it so that I'm not made a liar. What was the question?
How does California do it? Because they have 12 weeks of paid leave.
So California is diametrically different than the southern states. I mean, I don't know how to say it even any better than that. So it's funny when we talk about a whole lot of different things, whether you're talking about doula, Medicaid reimbursement, or all of the things that some conservatives call crunchy granola and now woke, right? I don't want to get into that, conversation, but California has just an ideological different tone than a lot of the southern states. So that's how they do it, right? Like
culture.
Like the culture, the prioritization, the destigmatization, like these conversations have been happening, and the vast majority of residents get behind a lot of the things that we know work. And it's frustrating for me as an advocate because, just purely anecdotal, when I walk in a room, there's a lot of misconceptions about what my ideological beliefs are, right? People will think I'm out there burning bras and doing all these kind of, liberal things, which is very different than what my actual belief systems are, Similarly, when we think about different states, California tends to be that state that are about that bra burning life, right? In Georgia, not as much, but certainly we're starting to see more understanding around the importance of these type of issues. And my frustration comes in, like, it's not a thing. It's not a crunchy granola thing. It's the truth thing, right? It is a non-controversial thing that has somehow become politicized. Like, at what point in history did we move from it is a very normal, natural thing to breastfeed and provide human milk to your baby to, like in my family, it becoming nasty, right? Like where did we lose ourselves along the line, and how did it become this controversial conversation? And that's where I really take pride in our nonpartisan approach to things. Unfortunately, we still have to lead to water, because cognitive dissonance is real. And, sometimes you've had certain ideologies for so long, you don't even remember why, hence why breastfeeding is thought of as nasty, right? You're like, where did that come from?
I know where it came from.
Do you? Please.
Misogyny.
Y'all gonna have me preaching. But I think that it's really important for us to stay narrowly focused on truth, y'all. Especially in Georgia, like we are starting to see the legislature specifically coming around to the light. I mean, postpartum Medicaid has been on our agenda for 20 years. And all of a sudden, with that gentle, not so gentle pressure about 4.5 years ago, you started to see these birthing friendly policies popping up out of everywhere, right? So, like sometimes it's getting some slaps on them knuckles to make legislators understand that this is an issue that matters. And then COVID came in with the wind, and we were like, ho, 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 y'all know ladies matter now. Let's get down to the Capitol and ask for everything, right? And now we're seeing all of these fantastic, talk about mental health supports and the shift from, the crackhead narrative to now substance use disorders, right? Like these are real conversations that are happening. Some would contend a little too late, but others, like, at least they're happening now, y'all.
Better than
right?
ever.
So I would just say, there's no secret sauce in California in terms of talent or conviction. It's just a matter of more education, us raising HE double hockey sticks more about things that matter to us. And I think we need to storytell in ways that we haven't really done before. And I have like a conflicting viewpoint because you don't want people to have to reopen trauma. I am not about the glorified trauma game, but those stories, particularly for constituents of individuals who have power over like our Health and Human Services Committee, go find one of their constituents who had some workplace accommodation issues.
Senator Manchin. He's from one of the poorest states in the U.S., right?
And then get them in there every day. The squeakiest wheel gets the most attention, baby. That's what we need to do.
I think the other thing that you brought up, which I think is really important, is that coalition building. And so one of the things I've found is that I've stopped talking about parental leave and started talking about family medical leave. Because not everyone will be a parent, or not everybody will be a parent in the future, but almost everyone will have a medical problem one day. And by pulling people in instead of pushing them away, I find that I get a lot more conversation going and get a lot more buy-in from colleagues because they see themselves as being beneficiaries, right? Oh, well, what if my mom's sick and I need to take care of her? What if I need a knee replacement? What if I have a heart attack? Like, what if I have a baby? All of those things. But we can't, if our focus is so narrow that people can push us out of the way, I think we're missing an opportunity to make a broader coalition. And I think that's one thing that we could do better because there are so many people that could benefit from something like that. I would love to hear some comments and questions about the idea of how appropriate paid leave affects breast and chest feeding and affects the provision of human milk, if anybody has any comments or questions.
Thank you all. It was good to hear the different insights on this topic because working as a peer counselor in the WIC office, you see moms that have to juggle between going back to work or breastfeeding or going back to work just at 4 weeks after having a baby. And you're like, you're still open. Why? Do you even have to worry about such a thing after you just had a baby? And to be able to get some kind of leave, whether it's under the family medical or paternal or maternal leave, it will make, because a lot of women now are the breadwinners of their households. Mm-hmm. So if we're working more in the workforce, why isn't there any more laws geared towards the needs that we have as being the predominant workforce members?
Yeah, it's our power, right? Unemployment is 3.5%. And we make a lot of the workforce. Why are there so few policies to protect us and support us, right?
I will transparently say because we're not represented enough in the decision-making rooms. We're doing better, right? We have representation, but we could have more. I have no desire to run for office, but maybe one of y'all do. Mm-hmm.
Anyone else?
Hello, good job, you guys. I'm definitely enjoying you guys' conversation. But at the same time, talking about, voting for things, so we need to be more careful who are we voting for and what we're demanding, because sometimes we vote and we're not demanding anything. So we get whatever we not even asking for. Mm-hmm. So, and then for breastfeeding, so let's continue to support our breastfeeding moms and make breastfeeding look norm.
Mm-hmm.
You know, when the breastfeeding mom come to our WIC office, I always tell them, this office, you can breastfeed anywhere and don't let anybody discourage you.
Mm-hmm.
Okay, feel free. So we have to make it look norm rather than always allowing them to feel like they have to cover up themselves. And then we're gonna continue to have the conversation, like you said, make it look like nasty and make it look like as if our breast is just sexual. Okay, so let's try to change the narrative.
You said something super powerful about the legislation and know what you're voting about. I'm not going to talk about some of the flack that we've gotten as an agency for supporting certain legislation in the past that had unintended consequences for Black and Brown communities, especially those who were practicing as breastfeeding counselors, as an example. But I'll use something more relevant to the now about our Medicaid doula reimbursement. It became a provocative conversation a couple of years ago, and largely a couple of states were reimbursing. I laugh because it's just offensive. Doulas $350 for their like full scope of service. And if you know anything about doula work, you know that that is incredibly offensive. But also reverberating implications on the type of certification they needed, the scope of service for something that was inherently centered in culture. So we're exploring that idea here in Georgia, but instead of modeling another state's policy, we went all over the country to understand what did y'all do right, but more importantly, what did y'all do wrong and who did it piss off, right? So that when we recommend legislation, it's designed in a way that reduces harm as much as possible. There's literally always going to be an outlier. I think even in the Pump Act and in Charlotte's Law, when you talk about, you know, bus drivers and flight attendants and things like that, in theory, it's like, yeah, you could give them a space, but like if you're on a bus, I mean, and you don't have the money to have like, what do you call those?
The wearable pumps.
Yeah, a wearable pump. And what you gonna do, right? Like, I mean, you're gonna like have one arm on the wheel and pump. Like, so there's always gonna be like some outliers, and you have to know what that bandwidth looks like. What's the floor and what's the ceiling? And the lay person isn't expected to know the nuances of legislation, but they should have a trusted partner or space where they can get that confidence and information from. So I would contend that that's many of you sitting in this room, right? Like you are tasked with not only service delivery, but also learning these laws, man, so that y'all can give credible information. And then, you know, when advocating and like policy and systems changes conversations happen, be able to mobilize folks, right? When they come see you, like, girl, did you know they got this paid leave thing on the books now, and how this gonna help you? You need to get down and go to the people's house, right? Because there still is people who are afraid to go down to the Gold Dome. That is, I know it's again jargony, but that's your house. Like you pay everybody in that building.
And you know what? You know who got hurt is the person who showed up,
yes.
Right?
The
people who didn't come, they didn't get a say.
The people who didn't come. Similar
That's
to
right.
to the vote, right? So if you don't feel uncomfortable going to your apartment or your house that you pay whole rent for, then you should not feel uncomfortable going downtown and telling your legislators about the things that matter to you.
And I think the other thing that I forgot to mention, I'd love to hear Valtra talk about this, is our time is not free, right? When we're at home raising our children and having our children and feeding our children, those things cost, right? Who pays our bills? And Valtra was going to comment a little bit about why having financial resources is so important to the breastfeeding and chest feeding parent.
So for me, a lot of things like laws, and I have a tendency to always, I told Dr. Collins and Kai this, sometimes these things are easier when you have means, right? You have stuff to get it, all that stuff is easier to say or to do, to go down to the dome, whatever. Mm-hmm. But if I don't even have a ride to my doctor's office, I'm never even coming down there. I don't even know where it is. I'm not saying me personally. I'm just saying that that's your other stuff in life is more present in survival. And, I've had moms going back to Taco Bell at week 2 from delivery. What do you tell a mom? I remember one time a 16-year-old, she was like, I don't have no money. I don't have nothing. It will make you cry. And you really have to, with those moms, that's a whole different world trying to navigate, making sure they get pumps, making sure they empower themselves, that they will be able to do this. I had a group of strippers one time, as crazy as that sounds, but they came to class to get educated. It was a whole group of, one of them had breastfed and the child was bright. And so they tied in that the IQ with the stripping, the girl, and they like their breast sitting up high, made for good money. So, okay. So they come to class and you talk about trying to negotiate how to navigate that at home, being a stripper and breastfeeding, but they wanted to know. So we went over, okay, what are you going to do when you leak? What are you going to do if milk starts coming out? You got nursing pads, what to buy, what to get. So, and some moms literally have none of these things. We've seen moms with tissue and socks, and then talking to moms about stuff that they don't have money. You are going to have to use Ziploc bags if you don't have that. So being an advocate for resources and kind of thinking about the person who some of these things are never going to be an option. They're never going to, one day it will be great, but we do have to think of other ways. And I have strategized with moms where that's where I told you guys this yesterday. Hand expression, I'm telling you, is big, whether you like it or not. I remember I got busy at work, and the lactation people, they probably was shocked. I was the only I was first Black African-American lactation consultant Keystone Hospital had. They hired me from Kansas City. That's where I met Christy. Listen, I was tired of trying to figure out when to pump, and I'm worried about my milk supply right there in the room. I just unbuttoned it right there, popped them on. The whole office, oh, what is happening here? And I was like, y'all see breasts all day. You're about to see these every day. And because I got tired of it, right? Now, not every mom is going to be that bold. I'm not saying that, right, to just pop, to do that in front of people. But what I'm saying is empowering our mothers when they're in circumstances and situations that aren't normal. If you can get them to kind of think, like Kai is saying, to think about beforehand, before work, before you get going back to work, to think like that, to help them be able to navigate that. Because it's not easy having a 2 or 3-year-old and you have to wait for Medicaid to get a ride for 3 hours. Are you going to come up there and see your baby? Nick, you're not coming.
Right.
So we have to, I'm working on getting them transportation vouchers. So you're not waiting literally 3 hours, y'all, with a 2-year-old to go see a baby at the hospital. What you gonna do? You ain't going. You're not gonna go. I know I wouldn't. This would be me. Okay. Yeah. I guess I have to see that baby when they get close to getting out. And that's what happens.
Yeah.
So
speaking of things we can control, I want everyone in the room whose workplace offers any paid leave after the birth of a child to raise their hand.
Wow, that's great.
I want everyone to keep your hand raised if your workplace offers at least 6 weeks of paid leave. Does your workplace offer 8 weeks of paid leave? Notice all the panelists' hands are down. 12 weeks of paid leave. Okay. So that's pretty consistent. So about 11% of U.S. businesses offer 12 weeks of paid leave. Most of them are white-collar jobs. All right. Paid leave. You get your money, right?
I mean, I work in a hospital, and I'm pretty darn sure.
My hand was down.
Yeah. All the young women having babies in my hospital are saving up their sick leave.
Exactly.
And they're hoping that they can take as long as they can, but not. And if they're taking 12 weeks,
that's right.
It's usually because they're taking time without pay.
Right. So having to save your sick leave, having to use your PTO. There's lots of caveats here. All right. Let's talk about WIC packages, because we got to move things along. Oh my God, I have 5 minutes. All right. WIC food packages. Is it ethical to punish non-exclusive breastfeeders with smaller packages in a climate of negative social determinants of health. So just like what you were saying, Valtra, when you've got people who have challenges in terms of accessing resources, time, environment, culture, all of these things, is it ethical to say, oh, you're going to use formula, you get a smaller food package?
Okay, well, we might have to get the WIC people. I know some of you all are in here on this, but they're supposedly they get more food, more fruits and vegetables. Is that right? Okay. All right. So.
So I'm just going to repeat what you said to put it on the recording. So for WIC, if you're an exclusive breastfeeder, you get more food. If you breast and formula feed, you get some formula and less food. Is that ethical? Panelists? So the reason why I asked the question is, this is assuming everybody does not have the same opportunity based on their social determinants of health, right? So if you took two equal people that had equal resources and said, okay, you exclusive breastfeeder get more food and you non-exclusive breastfeeder get food and formula, great. But for people who have less resources, like let's say, the parent who's out waiting 3 hours for the bus, and they didn't get the chance to pump because they were standing curbside waiting and they're dealing with their 2-year-old, and then their milk supply goes down and their baby's coming home and they can only do a little bit of breastfeeding and some formula feeding. Is that ethical?
Well, no, not presented that way. It doesn't sound like it at all.
Okay, just checking.
I'm like, well, do I need to go donate with some groceries? That tears your heart. But to their point of promoting, for people to be exclusive, but no, of course, that doesn't sound fair at all. It doesn't. Because I do think that a lot of moms. I had a mom tell me, I came to a room with this girl, and y'all, she had all this stuff, and I was surprised. Grady, our population of vulnerable incomes are very low. And she had all these pump stuff and different stuff. And I was like, you're not breastfeeding the baby? And she was like, nah, I'm not breastfeeding the baby. And so I stood there for a minute. My gut told me, oh, she breastfeeding this baby. And I looked at her again. I said, are you sure you're not breastfeeding the baby? And she was like, okay, cool, right. I am breastfeeding the baby, but I ain't letting none of y'all find out because I'm going to get all that milk just in case something happened. Mm-hmm. So she thought that if she told any of the staff, which is sad to me, right, mm-hmm. that because one is messing up our numbers, like from, statistics standpoint, but she thought that legitly if she told any staff she was breastfeeding her baby, her WIC package, she would not, she couldn't get formula because she would get exclusive. And she was like, I don't know what'll happen when 6 weeks from now, I don't know what'll happen in 3 months from now. I'm not going to tell them I'm exclusive breastfeeding just in case it doesn't work out. And I couldn't argue with her, right, about her circumstance. Now, for me, I'm a breastfeed regardless. I don't even it's just going, people could be looking, I have been broke and rich breastfeeding. It's going to happen every which way. But not everybody has that attitude, right? And I think, honestly, breastfeeding is a way out of poverty. That's another conversation. To encourage people, when you are broke and your income is low, your child will be brighter. So they're going to be calling you less up at the school, less running around like a chicken head, doing something productive. And also, you didn't have to go to the doctor's office every 5 minutes because your child is doing better. But we'll get on that. But really, seriously, I think people and lower incomes to get WIC, I think they do sometimes they are exclusively breastfeeding because of the uncertainty of life and what things can come up and bring.
Does it also say something about how scarce people feel about the resources that they would be like,
yes,
actually, I need you to hand me those cans of formula because 4 weeks from now or 6 weeks from now, I may not be able to get it.
Exactly.
Nandy, I wanted you to chime in.
No, I was going to say, even outside of that, though, we think about the shortage we just had. Mm-hmm. I could imagine someone saying, oh, no, I'm not exclusive because the shortage might happen again and they're trying to stock up, right? Mm-hmm. But then I also consider when I had my first child and I told them that I was planning to exclusively breastfeed, they still sent me home with formula. Somebody else could have had that didn't have what I had, or, you know, even though I've had conversations with folks in this room today that I struggled the first time around, but they didn't know that was going to happen. I could have gotten the formula later. I also had the resources to go buy formula. There could have been someone else in the hospital that needed it, but they just sent it home.
Mm-hmm.
So, I mean, I think we need to balance these things. Language is important. I think when we consider the person that needs it, what we're providing, how we're educating on what we're providing and why, like, I think all of that is important.
Yeah, I agree. And I think this really rolls into the next slide about formula shortage. You know, when we're bridging parents at the hospital, I mean, a lot of people need small amounts of supplement around day 2 and day 3 when their milk is coming in to get them through maybe a little bit of weight loss or some elevated bilirubins. Are there ethical implications about using formula in that setting? Why are we not using human milk? Because are we sort of inadvertently saying, well, formula is good. You know, when you get out of the hospital, you'll be able to use this, but they may get home and not be able to buy it. Apparently, there are still many issues about supply currently in the U.S. So this has been going on for a year. Like, is this the way to do it?
You know, so I would obviously advocate to have donor milk, but then you get into conversations with, I ain't gonna be able to pay for the donor milk at home. What are they gonna do when they get home? So it's no need to start the donor milk, you know, because this actually was a real conversation I had with someone. So they were like, why even give them the donor milk? You know, that's where, I don't know, like more so like I think skill set sometimes comes in, even with lactation consultants, where is the mom really having a supply issue? Do we really need to even supplement unless the baby's weight is getting over 8, 9, 10%?
Mm-hmm.
Can we just muster through past this? You know, like I've had babies, 2 of mine at 9%, 10%. I wasn't gonna do anything about it. You ain't gonna die. Your stomach like this big, you know, you'll make it. But people are, you know, in the United States, we're scared. We like to feed people, you know, I mean, that's what we do.
Mm-hmm.
And so I think that, you know, looking at the what is actually happening individually, case by case with that versus just going straight to you need to supplement.
Mm-hmm.
And
so that reassurance.
If you could use donor breast milk, yes, ideally, till that milk comes in would be great.
Well, and I know what I did when I took my baby home. My best friend had left milk in the freezer for me, right? And so the nice thing about using the human milk was I had a friend who could provide it, right? And then the other part about using human milk was I wasn't going to go buy human milk, right? Like, you know, if I get an ounce of human milk in the hospital, it's not like I'm going to be like, oh, where do I find this in the community, right? There is not the incentive of, oh, well, I'm going to get more, right? Like almost no one in Georgia buys human milk on their own, right? And so I think there is that saying like, oh, we're providing something beneficial to you, but you're going to go home and you're going to do it on your own too, you know? So I think that that's an interesting thing we can consider, especially once we have increased access to donor milk. But
so I wanted to interject a little bit on this. So the data says actually, if we support moms in the hospital with bridge milk, as Dr. Stellwagen said, mm-hmm. right, they actually have a much higher rate of being successful. And it doesn't cost us that much,
no.
right? Because the issue is that it is a precious resource. Right? There's not enough there's not enough to go around to cover all the preemies who need it,
milk.
plus
Yes.
all the term bridge in many places. Her milk bank, luckily, is able to do that for the people who are accessing it. If we expanded this program to cover all bridging for all babies across the country, it may come into more of a crunch than we can currently handle. But as she said, that might induce more people who have benefited to turn around and donate later when they're successful.
Do we make it easier to have peer-to-peer donor milk available, right?
With
like,
some
hey,
admonition
I'm
on how
having
to
a baby.
pasteurize.
My best friend just had a baby. They've got stored milk. Can I bring her milk to the hospital just in case I need bridge milk? And
So
not having policies that make that illegal, right, at your hospital.
Because you don't have HIV testing, you don't have Hep B testing, you don't have Hep C testing. And in a hospital environment, it's not necessarily considered safe from our perspective, and we would feel more comfortable if people use the ABM policy on home pasteurization if they're having informal milk sharing.
And these are all great things to talk about.
Cook it up on your stove. It's really not that hard. 65 degrees, 30 minutes, let it cool.
Use the mic. Sorry.
In the NICU and with the formula disaster and just donor breast milk in general being a very scarce and hard resource, we have definitely seen an increase in milk sharing and mothers asking. So we now have a waiver and they sign, and the NEO educates them on the risk involved, and they sign the waiver. Just like if they want to bring in a formula from the outside that we don't provide, we go over it, educate them, and they sign a waiver. But this is, when you're looking at the situation that we've dealt with over the past 2 years with this formula, you have to look at other options, and this is an option that we've had to look at. And I'm at first it was like, what are we doing? But when you can't get formula, when I can't even get formula to feed the babies in the NICU, I mean, like, I couldn't get what I needed.
PET milk, right?
Yeah. So
what are you going to do?
You have to come up with other solutions, and I think that this is where it's going, and we need to look at it.
Any ideas on the panel about
What, milk sharing?
any of this?
Oh yeah, I mean, I think that you're going to have to look at stuff like that. People will have to decide the risk because you don't know. People hide stuff all the time. Hepatitis, they got this or that. But if I don't think we have a choice. I don't think it's bad anyway. Like, if somebody wants to use their sister's milk, that's their choice. If they trust her, they have the right to that. That your best friend has milk for you in the freezer. One thing in our community, and I can say this as African American people, there's a lot of weed smoking that goes on. And
it's in every community, not just I just like to say.
It's really high in our community. Okay, but I know it might be everybody, but I promise you.
Everybody.
Okay.
That's what we say it in Georgia.
Listen, let me say this. So I literally know a couple moms. My daughter-in-law had a baby, and her sister was so happy she had the baby because she could now go back to smoking weed. And so she started giving, my daughter-in-law provided her baby milk. So she wanted the baby to have breast milk. Now, to me, there's a whole nother level of education that needs to be going on to why the weed is more important than you breastfeeding your baby. She was breastfeeding fine, nothing was wrong. And so I think we're gonna see milk sharing regardless for a lot of reasons. It's gonna happen. Formula shortage, just because people got other stuff going on with medications, and we're gonna have to get stuff like waivers and policy stuff in place.
Yeah, I think talking about pasteurization and talking about how to do peer-to-peer sharing. Oh, we gotta give up. Oh. All right.
Clearly, we like to talk to each other, y'all.
So these are some resources. It's okay.
There's the phone
you guys
number,
will have access to all the slides
I couldn't remember.
These are some resources that we talked about during our presentation. Please take advantage. All of our contact and I forgot to put Valtra and some of our contact information. We will make sure that all of the emails are available. And please feel free to reach out to us after Kai's name on her email address. That's probably a period, I'm guessing. KY period. But we really appreciate you all participating today. And, we look forward to advocating with you all at the state and national level to make it easier for everyone to provide human milk to their babies.